colloquially, again, this is a word that, I mean, mental health, something, no, like everybody knows something about it and everybody has something to say about it. And what is colloquially said is not often true. So stress is something like that, and depression is something like that. You should actually meet someone who's depressed to know what depression really is. And most often, what many of us experience are like, yes, at some points in our life, we might have a mild clinical depression. We call it the clinical depression just so that we keep it away from all the colloquially going around. So clinical depression, yes, most of us might have experienced mild forms of it at some point in life or the other. But diagnostically speaking, it has to, we call it dysthymia, euthymia, like all that is there. Like that's all a lot of jargon again. So we have set diagnostic criteria for what is depression. So our depression assessment checklists and tools that we use are stuff that we do over, half an hour with a client, or sometimes up to an hour. And definitely it's not just feeling blue one day or even a week. It's not, I cannot get up from my bed today. It's not, I cannot get up from my bed the whole week. It's not, I feel like crying randomly for 2 days, 3 days. It has to be happening consistently, at least over 2 weeks or a month, before we can even consider a diagnosis.
Okay.
And then again, we go to the severity, like how severe is it? Is it, and again, like, the cause of it, is there a cause? And often we see a lot of having said that, depression does not present in the same way. You can see depression in someone who is always laughing, very happy-go-lucky, very high functioning again. And that's why, like, often, like, this person has depression. That's always a question, like when we see, success does not matter. Life situations does not matter. So often, like, we can see like terminally ill patients not having depression, but we can see people who are very successful, very happy, having everything that you could possibly think of, being depressed. So it's also very, it has a strong genetic background. It has a strong, not just genetic, it also has a strong hormonal, neurotransmitter, everything. Like, I mean, I had a client whose only cause, which we could trace to, was nutrition. And once we could fix that, she was better.
That's amazing.
So that's exactly why, if you feel like you have all these red flags, like you don't feel okay, you need to talk to a mental health professional, because they would be able to help you better, like instead of just self-diagnosing. I mean, like most often, like I find myself with my clients, I am fighting and arguing like a prosecutor against Dr. Google. I'm like, no, that's not what you read in Google. It's different. So don't self-diagnose. That would be like the first thing. And seek help. It's okay. I mean, like, we're all there. Nobody's going to judge you. A good therapist is going to keep everything confidential. Like I'm talking about a good qualified mental health professional at this, like I'm not talking about everybody out there, but a professional would know what to do, where to draw the line. Like, meeting them in a social context outside your therapy is different. And so, like, you know how to deal with it. The confidentiality, the privacy, nobody's going to judge you, the non-judgmental nature of session.